Welcome to week 7 of the Adult Weight Management Project. This week's topic is weight loss medications. The first thing that everybody needs to know or wants to know is their magic pill for weight loss. We have medicine for high blood pressure, we have medicine for high cholesterol. Why don't we have something that we can routinely treat weight loss for? Well, there's a few things out there on the market. Some of them help some, but their application is really limited. The pharmaceutical industry's guide for using weight loss medications is that weight loss medications should not be prescribed for anyone with a BMI that's less than 30 or a BMI of 27 to 29.9 with other comorbid conditions. That means other chronic conditions. Comorbid conditions would be like heart disease, high cholesterol, diabetes, that type of thing. There are times when weight loss medicine may be helpful. If weight loss medication is prescribed, then it must be in combination with diet, exercise, and lifestyle behavior changes to be efficient. You can't just depend on the medication. If you're going to take a weight loss medication, it's important to understand the risks and benefits of taking the medication. Some medications are approved for long-term use and others for short-term use only. One thing is you must understand the benefits as well as the risk of the medication. It's also important to be realistic about your weight loss goals when you use these medications. Over the years, there's been several types of weight loss medications on the market. Most of them have been taken off the market because of side effects associated with the drugs. Some of the first weight loss medications were amphetamines. The drugs were psychostimulant drugs, which decreased fatigue as well as appetite. These drugs became popular and were used recreational as performance enhancers, also known as speed. Research revealed possible neurotoxic and cardiac effect of these drugs, as well as addictive properties, so they were taken off the market. Also, for those taking the medications for weight loss, one of the withdrawal symptoms was increased appetite, so kind of defeated the purpose there. When I started working as a nurse practitioner in 1995, there was a very effective prescription weight loss on the market called Redux. It was an appetite suppressant. After it had been on the market for a while, a few years, it was noted that people taking the medication were developing a life-threatening condition called pulmonary hypertension. There is no cure for pulmonary hypertension. This is there are medications to control the symptoms, but you have to stay on the medication for life. Once this was discovered, Redux and several of the other similar prescription drugs and over-the-counter weight loss medications were also taken off the market. There are only a few prescription weight loss medicines on the market today. The only one approved for long-term use is one called Orlistat or Xenical. Orlistat is a medication that decreases the amount of fat your body absorbs from the food that you eat. There's a lower dose version that is now available over the counter. Orlistat is taken 3 times a day with meals. If you skip a meal, you can skip your dose of Orlistat, or if you eat a meal that contains no fat, you can skip a dose of Orlistat. Studies show that after 1 year of treatment with Orlistat, the average weight loss is approximately 8 to 10% of initial body weight, or about 4% more than people who took a placebo. So, a 200-pound person would lose approximately 18 to 20 pounds in a year using Orlistat. One benefit of Orlistat is that cholesterol levels often improve. This is because the fat is being excreted and not absorbed. Also, people with diabetes, after using the medication, often see an improvement in their blood sugars. Again, the fat is being excreted from the body. Orlistat, or side effects occur in 10 to 15% of the people. Side effects include stomach cramps, gas, diarrhea, leakage of stool, and oily stools. Orlistat indirectly makes you change the way you eat, because when you eat a meal with high fat, then you're going to get the diarrhea, oily stools, that type of thing. Another medication is called Meridia or sibutramine, and that's a weight loss appetite suppressant. Sibutramine can increase blood pressure in patients with elevated blood pressure or other risk factors for heart disease. Sibutramine can increase the risk of a heart attack and a stroke. So, because of these side effects, this medication was actually taken off the market in 2010. It's no longer available. Other weight loss medications include phentermine and, let me see if I can say this, diethylpropion. These two medications are Schedule IV medications, which means that they are controlled substances and they're not available without a prescription, but they also have the potential for addiction and abuse. And these are only approved for short-term use, and that means a maximum of 12 weeks. Dietary supplements are used widely by people trying to lose weight. This means over-the-counter medications. The safety and efficacy of these supplements is often unproven. I've listed a few of the most commonly used supplements here. The one I want to point out is ephedra. It's related to ephedrine, and it is no longer available in the United States due to the side effects. And this was previously what most of the over-the-counter diet pills contained. They've since redone them, and they have different medication in them now. The dietary supplements listed in this slide claim to be effective, but are not recommended. I'll let you read those yourself. There's other over-the-counter weight loss medications. There are some warnings. Here's a couple from Brazil. The U.S. Food and Drug Administration has issued a warning against these medications from Brazil. They've been shown to contain prescription drugs. One from South Africa, Hoodia gordoian or something like that. It's a dietary supplement from a plant in South Africa. It also is not recommended. There is no proof it is safe or effective. Antidepressants are not approved for weight loss in the United States. Both Wellbutrin and Prozac are antidepressants. That weight loss just happens to be one of the side effects. However, they're not approved here. In general, after people have taken antidepressants for a while, rather than weight loss, these medications cause weight gain. Also, the doses needed to treat obesity are higher than the doses recommended to treat depression. Often this is like 3 times the recommended dose. The initial weight loss achieved by 20 to 24 weeks using antidepressants may turn around and be a weight gain when the person has used the medication for 32 to 52 weeks. Okay, so today we have to discuss several drugs, both prescription and non-prescription, for weight loss. The important thing to remember about drug therapy related to weight loss is that it is helpful when comorbid or when combined with diet, exercise, and behavior modification, and these are things we're focusing on in our program. The main concern healthcare providers have in prescribing weight loss drugs is that studies show in most cases that if the patient does not change their diet, their behavior, and start exercising, that they're going to regain that weight when the drug is stopped. The use of medications for weight loss should only be used after careful evaluation of the risks and benefits. In other words, the benefits must outweigh the risks for using these medications. These medications do not cure obesity. The success of a weight loss plan may be measured by the amount of weight that is lost and improvement in associated risk factors. A weight loss of 5 to 10% of total body weight can significantly reduce the risk factors like for diabetes, heart disease, and some of these that are associated with high morbidity and mortality. The bottom line for drug therapy with weight loss is drug therapy does not cure obesity. When the maximal therapeutic effect is reached, the weight loss stops. When the drug therapy is discontinued, unless diet and behavior changes have occurred, the person is going to regain their weight that they lost. Okay, and that's so much for today. Next week's presentation is going to be on hormones and weight control. I'll be glad to take any questions now.